How like okay, how likely is it that Fat Ass 45 is still contagious with the COVID? Less than 11 days after announcing that he had been diagnosed with the COVID-19, Fat Ass 45 traveled on Air Force One to a Klan rally in Florida where he spoke for an hour and declared that he was now immune to the virus. You can't be immune if you caught it, you fucking idiot. Threatened to rape the entire audience and mocked Joe Biden for adhering to social distancing measures at his Klan rallies. This behavior in the middle of a deadly pandemic would be questionable for any supposed leader, but these actions are the worst because it's possible that Fat Ass 45 is still infectious. The argument that Fat Ass 45 is not infectious comes from his doctor, Sean Connolly. Connolly's reasoning hinges on largely two things. First, that Fat Ass 45 meets the Center for Disease Control's criteria for the safe discontinuation or of isolation, as Connolly wrote in a memo that was dated back October 10th. Because more than 10 days had passed since Fat Ass 45 first tested positive, and second, that Fat Ass 45 has tested negative for the virus using a rapid test, as Connolly wrote in an October 12th memo. It is certainly possible that Fat Ass 45 is no longer infectious, but the CDC guideline notes that it's people with mild to moderate COVID-19 who aren't infectious 10 days following symptom onset. So if Fat Ass 45's illness was indeed mild to moderate, then yes, according to the CDC, there was a good reason to believe that he was not infectious, but was it a mild to moderate illness? That narrative is contradicted by Fat Ass 45's trip to the hospital and the slew of drugs that Fat Ass 45 received there, including steroids, a treatment shown to be effective only for very sick COVID-19 patients. Steroids are potentially harmful to others. Fat Ass 45 himself declared last week on Twitter that he'd been very sick when he headed to Walter Reed, but it's hard to say what the hospital, the drugs, the proclamation that he was very sick really tells us about Fat Ass 45's illness. It could signal the kind of precaution we take with the squatter, or it could be an attempt to sell an experimental drug cocktail made by a member from one of the Fat Ass's golf clubs. But how bad Fat Ass 45's illness was matters for understanding his recovery. According to those CDC guidelines, a limited number of persons with severe illnesses may warrant extending duration of isolation and precautions. That duration is up to 20 days, putting Fat Ass 45 and his clan merely squarely in the window of a potentially still infectious. These guidelines are largely for people without access to testing, which is not the situation the squatter is in. He can and did get tested. The test that Conley says he used is the Abbott Binax Now antigen card, and it showed he was negative on consecutive days, according to Conley, but at BuzzFeed reporter Stephanie Lee assembles a convincing case for not taking Fat Ass 45's negative antigen test at face value. The FDA has authorized it for use on patients who are within a week of the onset of COVID-19 symptoms. It's not meant to be used in days after the infection declines. The CDC does not recommend using antigen tests to clear patients from isolation. What experts really want to see are the results of a PCR test. So how did Fat Ass 45 do on that test? As Conley wrote in the October 10th memo, this morning's COVID PCR sample demonstrates by currently recognized standards he is no longer considered a transmission risk to others. That sure sounds like he tested negative, but then why wouldn't they just say outright that Fat Ass 45 tested negative on the PCR test? Maybe because he didn't. Conley has already proven, both prior to and during Fat Ass 45's illness, to be willing to hide and massage the facts about Fat Ass 45's health. But you can't trust Conley's word, perhaps particularly when it coincides with the version of the truth that is most convenient for Fat Ass 45. It's not even clear that Fat Ass 45 was getting regularly tested prior to being infected with COVID. At a minimum, Conley was unwilling to share information about that testing with the public. After Fat Ass 45 had spent the weekend in the hospital, Conley wouldn't even tell reporters when Fat Ass 45's last negative test was. On that logic, that I don't want to go backwards. Attending a crowded campaign event less than 2 weeks after a COVID-19 diagnosis without full disclosures, it's just the latest move on Fat Ass 45's attempts to paint his case of COVID-19 as a mild to moderate. The effort echoes his guidance on the coronavirus in general. He wants people to think that the pandemic is not that big of a deal. Whether or not he was actively shedding the virus when he traveled to Florida, the message of the anemic disclosures on Fat Ass 45's health is perhaps the most dangerous of all. But what's most important to him is to show that there's nothing more to worry about. Here is what he's trying to convince people. So if you like the video, give the video a like and subscribe to my channel, Rambling Mike, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.